Moving on to the next section, we've got the calf, and we're going to go ahead and start working gastrocnemius and soleus. So what I like to do as far as the calf is concerned is trace out the region here where it compartmentalizes and separates into the shin. And what you can do is just grab the muscle belly, pull it off to the side, and you can work down the line here as far as soft tissue structure is concerned and loosen that up. Especially if people have tight hamstrings and low backs, this is very important. So we start working our way down on the lateral aspect of gastrocnemius. We can pull it back over, and we can work the medial section as well. And again, notice I'm still in contact with the device. This is very, very important to stay in contact. The dual probe aspect allows us to come right over the top of the Achilles tendon. What I try to do is I don't push the leg down to the table, but I actually bring it up a bit so that the leg is a little bit looser on itself, and we're able to get those impulses on the Achilles tendon, loosen up that musculature as well. Okay? So then we're going to go ahead and move on to the foot. And one of the most classic conditions that we get, especially in low back patients, is we get plantar fasciitis. Oh, that's a big one. As far as plantar fasciitis, we usually notice that the origin and insertion point for the plantar fasciitis are very, very painful. We start pushing right here as far as the insertion point of the plantar fascia, and we start noticing the patient starts to react. Sometimes we'll get it on the lateral portion of the foot, and sometimes we'll get into the origin portion where traction spurs are very famously happening here for happening as far as bone spurs are concerned. That fascia can pull so tight you can start bone spurs cutting off of the calcaneus. So what we really want to do here is try to, again, ease the comfort of the patient. If there's a lot of fibrosis in the fascia, and the patient's a strong, well-built individual, you can go for a direct angle as far as the foot is concerned. Now you have to remember your force of drive when you're in this position is going to have the strongest impact. So what we can do is we work on the insertion point, the origin points, and then the belly of the fascia. And it's very easy to work on. You can also work on the lateral aspect. Sometimes they're very reactive. If that foot shoots away, you don't just sit here and lock into it. And another thing to stabilize the foot, sometimes you'll bring it against your body. Be very careful about your midline section not to freak your patient out. Okay? Safety and security for the patient are always your top priority. So as far as the fascia is concerned, you can start working it in the downward motion. You can also have the patient supine, but I find that this is a lot easier on the chiropractor's back, just to bend the leg here and start working it. You can also give arch adjustments. If you're working in orthotics and you want to adjust the arch here, it's very easy to do. You can do it with a single probe or the small dual, and basically come in here in on the bones of the foot and start trying to increase the arch. Very easy to do. If the fascia is very loose, or very tight actually, right around the metatarsal heads, what you can do is you can do the distal portion, go right on top of the ball of the foot, and more so the proximal balls of the tarsals. That's also the insertion point here as far as the plantar fascia. So those are all wonderful areas to adjust. The more that you do this, the faster your impacts, you can actually notice that this impact can get very fast. I'm going to give you a little bit of a close-up here. But the fact of the matter is that when you start adjusting, you can do a single click. Okay. Or you can do fast, and I use my middle finger as far as to get a faster adjustment. Some docs like the automatic version, but nonetheless you can cycle through on the single shot devices as well. These are very effective in these types of conditions. So let's go ahead and move on to the upper extremities.